My name's Tom MacLaren. I'm a consultant psychiatrist at Cognition Health, and I do general mental health assessment, anxiety, depression and other mental health conditions, as well as a more specialist assessment of people's memory. The services I provide here are, I see adults of all ages, so people in their 20s, 30s or 40s and upwards who have worries about maybe memory and concentration at work. They might be worried about feeling low or anxious, so having general mental health concerns, or it might take the form of worries about their memory, the things we call cognitive function, so memory and thinking, how they work out problems and how well their brain is working, and that's something we can assess in really great detail at Cognition. A consultation might typically involve meeting a patient with their family, often with maybe their spouse or with their close relatives. Sometimes their carers will come in too, and we'll sit around in the consultation room and I'll get to know about them. It's a very relaxed conversation, and then we'll do some more specific testing, often of their memory, a cognitive assessment. After the consultation, for example, people will usually go for a blood test and then have a brain scan, and then we'll usually meet again to talk about the next steps. The ways my service benefits patients is giving them a diagnosis. Often it can shed light on things they might not realise have been going on for a long time. So that's especially the case if people, let's say older people for example, are suffering with dementia, and that can be really difficult often to find out more about without a quick assessment, without a timely assessment. This is something we can do really well at Cognition. We can give this comprehensive service to people. I really like psychiatry and mental health, and it's a real passion of mine. I've done a lot of work with people in the community around London for many years now, and it's a real pleasure to work with patients and their carers and the whole network around people, to be able to help people with the diagnosis, help people with the right treatment, set them on the right course. And get them the extra support they need. So social care support and benefits, entitlements too, that people might be able to get that they didn't have before, as well as having that knowledge of having an idea about what's actually going on, what's actually causing the problem.